What you're looking at right here, well, this is a big deal for us. This is the culmination of 5 years of truly pioneering work. This report lays out a groundbreaking, clinically tracked model for Ruqyah, a form of spiritual healthcare. And believe me, it's so much more than just data. It's a whole new standard. So let's dive in and explore what we've discovered together. So let's start with the big question, the one that really kicked this whole thing off. Can spiritual healing actually be measured? Can you put real numbers to it? For 5 years, this was the fundamental challenge we set out to answer. Because for way too long, the field has just been seen as, well, subjective. Something you feel, sure, but can never really verify. We knew it was time for that to change.
We founded the Ruqya Clinic precisely because of this crisis. We saw that conventional treatments so often overlook the spiritual parts of an illness, and this leaves a huge gap in care. We were absolutely determined to fill that gap by creating a method that truly integrates both faith and science. Okay, so before you can even begin to measure healing, you need a rock-solid definition of recovery. We knew right from the start that just feeling better wasn't going to cut it. That's way too vague. We had to establish a rigorous clinical standard for what genuine recovery actually looks like. So this is what we developed. We call it dual-dimensional recovery. A patient is only officially considered recovered when 2 very distinct criteria are met. First, the spiritual ailment is just gone. We re-diagnose and it's no longer present. And second, just as important, their functional life, their emotional stability, their daily routines is back to normal. This is how we ensure that the recovery is both real and sustainable. And here's how we verify it. Every single patient follows this clear 4-step process. It begins with an initial diagnosis, then they go through our structured treatment, and then comes a final re-diagnosis using the exact same methods. A case is only closed and marked as recovered when there is 0 spiritual reaction. There's no guesswork, it's objective.
So what happens when you apply this incredibly rigorous methodology, day in and day out, for 5 straight years? Well, the results are pretty remarkable. It's time to let the numbers speak for themselves.
First, just for some context, let's look at the benchmark. The global average recovery rates for most conventional mental health therapies, according to major health organizations, typically fall somewhere between 20 and 50%. So just keep that range in mind.
Now, compare that to our results. For patients who completed our full, structured treatment program, we have consistently achieved a verified recovery rate between 84 and 95%. This isn't just a small improvement, it's a monumental leap forward. It's powerful, tangible proof of how effective this integrated model really is. And for complete transparency, which is crucial to us, we report our data 2 ways. Overall recovery includes every single patient who started treatment with us, even those who dropped out for one reason or another. But the true measure of our method's success is the clinical recovery rate. That's the number that focuses only on those who saw the program all the way through and had their recovery verified at the end. This chart really just puts the contrast in black and white. From the recovery rates, to the verification process, to the integrated approach itself, it becomes so clear that we're not just improving on an old model, we've really built something entirely new. But here's a key question. Can these incredible results be repeated? Is it some kind of fluke? Absolutely not. This success isn't by chance, it is by design. It's built right into a system that is both consistent and, most importantly, replicable. This chart is a perfect demonstration of the system's predictability. I mean, think about it. We see a huge variety of cases, yet the vast majority of our patients achieve that verified recovery in just 6 to 8 sessions. That kind of consistency doesn't happen by accident. It proves we have a reliable clinical system in place. Our model is so replicable because the system itself does the heavy lifting. A patient's progress doesn't depend on the personality of one specific practitioner. It depends on the method. This makes the healing process scientifically repeatable, allowing any practitioner who's trained in our model to produce the same high standard of results. This is the evolution that we've championed. We've taken the timeless principles of a traditional practice, and we've integrated them into a modern, evidence-based healthcare system. It's truly a synthesis of faith and science. So what does all of this really mean for the future of healing? It means we've unlocked a new potential. We've made recovery something that is measurable, trackable, and reproducible. The big takeaway is this. Our work proves that recovery from spiritual ailments is no longer just anecdotal. It's not just a story someone tells you. It can be clinically measured, it can be tracked with objective data, and it can be reproduced with astounding consistency. This journey has really proven what's possible when structure meets spirit. We've shown that recovery can be predictable. And that leads us with one profound question for the next 5 years. If this is possible, what else is now within our reach?